Hey, did you hear about Hazima?
Why?
I heard she's run away from home.
Really?
Hey, are you okay? Mia? Oh my god. You're coughing blood.
What does this mean?
Maybe you have TB.
What's TB?
Ha! Did you know what is TB mean? TB is a short name for tuberculosis. TB is a disease caused by Microbacterium tuberculosis, and it mainly affects the lung. However, it is a multi-systemic disease, meaning it can spread to other parts of the body, such as the brain, spine, and also kidneys. TB has been around for thousands of years and is still a major health concern today. In the past, TB was one of the leading causes of death in Malaysia, especially before 1950. However, in 1961, the Malaysian government launched the National TB Control Program to reduce TB cases. This program was successful for many years, and TB cases started to decline. Unfortunately, after 2010, TB cases began to rise again. This situation became more worse during 2021 and 2022, when Malaysia recorded the highest number of TB cases in 14 years.
Good morning, Miss Mia. What brings you here today?
Good morning, doctor. Actually, I came here because I've been coughing for a few weeks by now, and I've been coughing blood. My friend suggests that I maybe have tuberculosis. Can you confirm that?
I see. So I will list out a list of symptoms for TB, and I want to tell us, does all of these symptoms sounds familiar to you? First of all, coughing for 3 weeks straight with sometimes blood and mucus included in it. Second, shortness of breath, chest pain, and also breathing difficulty, especially whenever you are breathing and coughing. Third, the unexpected and unexplained weight loss and also the loss of appetite. And lastly, the feeling of weakness, fatigue, night shivers and sweat, and also fever and being sick for long period of time.
Yes, I experienced all of these symptoms.
I see. So Dr. Joffrey will explain what is happening to you.
Based on your symptoms, you might have TB. It's a lung infection caused by Mycobacterium tuberculosis, a type of bacteria.
Oh, I see. What causes this infection? How did I get it?
TB spread through the air when an infected person coughs, sneezes, or even talks. If you breathe in the bacteria, it can enter your lungs and cause an infection.
Oh, so just by being near someone, I can get TB?
Yes, but usually TB spread through a long-term exposure to an infected person. It doesn't spread through touching, sharing food, or casual contact. People who live or work in crowded places like dormitories, prison, or hospitals are higher at risk.
Oh, I live in a shared dormitory. Maybe I got it there?
That's possible. TB is more common in places with poor ventilation, where the bacteria can stay in the air longer.
Are some people more likely to get TB than others?
Yes, some people have a higher risk, such as those with weak immune system, for example, people with HIV, diabetes, or malnutrition, people who smoke or have other lung diseases, those living in overcrowded or unsanitary conditions, and healthcare workers who come into contact with TB patients frequently.
I have some bad news. I actually do have tuberculosis, like she mentioned before.
Oh, I'm sorry to hear that, Mia.
But I've never heard of tuberculosis before. Are they common in Malaysia?
Yes, it's usually common in Malaysia. 2023, Malaysia recorded over 2,500 TB cases, and that's about 70 new cases every day. Tragically, TB claimed the lives of 1,844 Malaysians last year. That's 5 people every day losing their battle to this horrible disease. The ratio of a female to male is 5 to 1. TB isn't just a rural or urban problem. It thrives where overcrowding, pure ventilation, and delayed treatment collided. Malaysia had been making steady progress in reducing TB cases for years. However, the COVID-19 pandemic disrupted screening and treatment, causing a concerning rise in diagnosed cases.
So, is it possible for you guys to get infected by me?
Oh, don't worry about us. We'll take careful precautions for tuberculosis. Firstly, we'll make sure to take the TB vaccine called BCG that'll help protect our body from potential tuberculosis disease. Secondly, we will also maintain our hygiene by always washing our hands and wearing masks to cover our nose and mouth. We will also try to avoid physical contact with people who have tuberculosis. And lastly, we're going to get tested for tuberculosis so that if we have tuberculosis, then it can get treated at an early stage. Did the doctors mention any treatments that you can get?
Oh, the doctors gave me 5 medicines actually, which includes isoniazid, rifampicin, pyrazinamide, streptomycin, and ethambutol. These medicines will help to stop the tuberculosis bacteria in my body from multiplying, and this will make it easier for my body to fight off the infection and get rid of the bacteria in my body.
Is there any other treatment besides medicine?
The doctors might have suggested some physical exercises, including yoga, cycling, and walking.
How do those physical activities help your tuberculosis?
Well, for yoga, the breathing exercise in yoga will help to induce relaxation and reduce the stress level of patients. As for walking and cycling, this is to make sure that the TB that was once inside my body is completely eradicated. And it's better for me to keep up the exercise to stop the tuberculosis from coming later on.
You're welcome, Mia.
Thank you.
Now we know that TB is still a serious issue in Malaysia, even though the government has made efforts and control it. To address this, Malaysia introduced the National Strategic Plan to end TB. This plan aims to reduce TB cases by half and save more lives through early detection, proper treatment, and also public awareness. To achieve a TB-free Malaysia, we need a strong teamwork between the government, health workers, and also public. People must be aware of TB symptoms, go for screening, and complete their treatment. With these efforts, Malaysia can move closer to eliminating TB and also ensuring their healthier future for everyone.
Yes, people have a higher risk such as those with weak... Laju ni pula. Asal laju sangat ni?
I'm so sorry to hear that, Mia.
And deaths. Tiba-tiba aku
TB is still a serious health issue in Malaysia. Even though
Did you hear about Hazima?
Why? What about her?
I heard she's going to UKM.
Oh, aku lupa dah batuk. Aku.
Mia? Oh my god.
Oh, ya lalat lah pula.
Did you hear about Hazima?
Why? What about her?
I heard she ran away from
Run away.
Did you guys know what? Did you guys know what? Kat mana kat sini? Did you guys know? Aduh, tapi ni sikit lagi weh. Penat. guys know? Did you guys know what is TB? Did you guys know what is TB mean?